Presentation and management of patients with adrenal masses, a large tertiary center experience by Suntorn-Lahanakul et al. Adrenal masses are found in up to 5 to 7% of adults. These may be benign or malignant with or without causing hormone excess. Their incidence is increasing due to frequent incidental discovery. The 2016 guidelines on the management of adrenal incidentalomas from ESC and NSAT have standardized the workup of these patients, but evidence of their impact on clinical practice is lacking. The primary aim was to evaluate the demographic, clinical, and radiological characteristics, hormonal secretion patterns, and management approaches before and after implementing the guidelines in a large cohort of patients referred to a tertiary centre. The secondary aim was to determine the best clinical and radiological predictors of malignancy. Patients aged 18 and over with adrenal masses referred to the Adrenal Tumour Service at the Queen Elizabeth Hospital, Birmingham were included. Retrospective review of clinical presentation, hormonal pattern, radiological characteristics, and final diagnosis was conducted, as well as sub-analysis for outcomes before and after implementing the guidelines. 1,397 patients were included, 55.7% were women, and the median age was 60 years. Incidental discovery was the most frequent mode of presentation, and 30.6% of patients had masses greater than or equal to 4 centimeters. 32.9% of masses were heterogeneous. The most common diagnoses were adrenocortical adenoma, pheochromocytoma, adrenocortical carcinoma, and metastases. Significant predictors of malignancy included heterogeneous density, detection during cancer surveillance, androgen excess, and male sex. After implementing the guidelines, the number of adrenalectomies decreased from 6.1% to 4.5%, and the number of patients discharged increased from 4.4% to 25.3%. Therefore, implementation of the guidelines resulted in a reduction in unnecessary follow-up visits and surgeries and increased discharge rate, hence preserving healthcare resources and patient burden and quality of life. To read more, please scan the QR code.